Hey everybody, it's Dr. Krenek again here at Bay City Chiropractic Center. And a question came up regarding spine rehab, and so I wanted to kind of touch on that just a little bit with you. Typically what happens is when a patient comes in, we refer to what's called the red zone, where we do no rehab at all during this time. It's very important to understand what's called the rule of order. Things have to be done in order to get the spine back in shape. And what we do first of all is we call this the red zone to where we rest it. Because your joints are unstable, you're generally swollen, it needs rest, some mild stretching, things of that nature. Then you walk into what's called phase 2, which is reconstruction, where the tissues are healing, they're firming up, and we gradually increase the stress on the joint or whatever area that we're rehabbing. Could be knee, maybe low back, neck, shoulder. Really enjoy shoulders, really enjoy knees. But typically, just for general sake and conversation, we're talking about rehab in general. And then what we finally do, we get to what's called the third phase, which is the green zone, and that's where the muscles really need to be looked at. So what we do is we don't really focus so much here. We work on the nerves, the joint, stress, gentle, easy type rehab, and then we start the muscle strengthening here, because in the final phase of care, what's going to happen is your muscle and ligaments are going to strengthen, then you're going to start to stabilize and correct, and then that's where you get that optimal function again, because so many people come to us where they've tried to go to the gym and start exercising, and they're getting worse, they're not doing any better, and that's why it's so important to understand what's called the rule of order. Okay, you have to do things in order, and this is the order of healing. You get your pain under control, let it stabilize, and then strengthen it. So if you would, just step in here with me, and I'm going to show you exactly what we do after we get the patient stable, and then we actually start the physical rehab of the part. Depending on what area that we're doing, depending on what area that we're working on, it will either be the neck or the low back, and we'll walk across the hall in a moment to talk about shoulder and knee. But for instance, if it's neck, we start patients on what's called a weight program. This is an 8-way where we do each component of your neck, your anterior, both lateral, of course, anterior and posterior, and we build the muscle of the neck. Then step up here with me. Then we also really focus on circulation. Say it would be like a low back case. We start you out on the exercise bike, which brings circulation into the part, and you know as well as I do, we have to have circulation for healing, where the nerve controls the part, but circulation brings nutrients into the area. Another part that we use is the low back rotation machine. Once we get patients stabilized with what's called a flexion extension machine, which is this one here that's represented, the patient sits down, they go forward and back, which is flexion and extension. Once that stabilizes, we move them over here to the rotational. We work on the multifidus and the rotators. Those are the small muscles of the spine that really give you the support that you need. And so this, of course, goes back and forth. And we have a therapist that works with you. Her name is Priscilla. Great, one of my great employees. You'll really enjoy her. She's really in depth at what she does. She's very good at it. And she'll work with you step by step along the way. And as we're doing that, as we're strengthening the muscle, we use what's called, we refer to it for patients' sake, it's called the shaker, which we have here and then here. And what it's really doing is producing balance. Because what you have to have is timing. It's all about timing. As you're standing on these, they vibrate and they shake back and forth. And what it's doing is it's actually riding what's called the cortical-thalamic tract, which comes out of the brain down the spinal cord. And what that does, it causes your muscle it actually contracts as your brain's telling it to do. So it's a timing issue, which is coordination, and those things have to be in harmony to really get your back in order. Another service that we have is cervical traction. We put your forehead in here, and we traction. We use your body weight to traction down. We do that at intervals. So what we're trying to do there is we're actually increasing disc space. We're also elongating the myofibrils. That's the muscle cells, and as we do that, of course allows the inflammation to drop, and that's what will give you relief as we're trying to rebuild neck. So if you would, let's step in here, and we have a rehab room that I typically use like for my extremity work, this is called the TheraBand, and we of course hook that up to the door, and we have certain protocols. We use scheduling for each part, whether it's the knee, or if it's the wrist or the elbow, the shoulder, whatever part is involved. We start with what's called a 1-band TheraBand, and then we'll up that. We'll use a double for low back, depending on what area we're working with. So we use a full scale RAM, whether it's shoulder, we could use a shoulder program. We start you out gently, increase the load, and then when you're able to use full range of motion under full stress, and we know we have the part rebuilt. So that's kind of an overview of how we touch on each individual rehab areas. If you have any other further questions on that, feel free to go to my website and take a look at that. There are different ideas on there for certain timing, when you do certain things. And if any questions come up, please contact me at Bay City Chiropractic Center. That's 979-245-6844. You can either email us, text us, however you would like to receive the information. We'll be happy to get that out for you. And if there's any questions regarding rehab, please give us a call. Any way that we can help you with your health, feel free to contact us. Be happy to work with you. Have a great day.